Happy Wednesday, everyone. I wanted to say thank you to everyone who watched my video yesterday and to everyone who reached out to me on Instagram or Facebook, sending me encouraging messages. I appreciate all of you and thank you so much. I'm going to do more videos on YouTube, so if you want to subscribe to the channel, I would, I really appreciate that. I thank you for all of the encouragement that you're giving me, so I'm going to continue to do the videos because I think it's a little educational at the same time. If it gets to help someone, that's basically what I'm trying to do. And if you have any questions, please reach out to me. Let me know. I can answer some stuff. I know yesterday's video was a little winded, and I'll probably be a little bit today, but I'll try to make them be less so it's not so overwhelming and drudging and you just continue on and on and on. I want to do that. So I just wanted to show you guys some of the effects from after the transplant. You get what's called graft versus host disease, and everyone experiences it. Some people get it very minimal, and then some people get it chronically, and that's what I have. It's something that I have on a daily basis, 24/7. And what that is your body is trying to graft to the person's bone marrow or whatever kind of transplant that you had. So while it's happening, your body sees it as a foreign entity, so it kind of wants to fight it. Just like when you have an infection or a cold, your body attacks it because it knows that it's foreign. And that's what happens after you have a transplant. Some people experience very mild symptoms and different things like that. For me, I was doing really well after the transplant. Everything was going good. We were celebrating. My sister was getting married. It was after the 100 days, and I got to go with them to try on wedding dresses. I did have my port in when we went to David's bridal, and they were nothing but nice to me. They couldn't be any nicer, any sweeter. When we were trying on dresses, I had to keep a tank top on because I still had my ports. They were still connected. And every dress that I tried on, they made sure that it was comfortable, that it didn't hurt anything. I really didn't have hair at the time, and honestly, they were very sweet, and we had a good time, and it was fun, and I'll show some pictures from that. And I just want to say, even though all that was still happening, we were still able to enjoy the other moments and the things that were happening. So I was happy that we had that, and we did that. And then not that long after, they took my port out, so everything was rolling along and it was going by very smoothly. And then I started to not feel good. Like little by little, I just felt pressure and bloated and just puffy. So I went to my oncology doctor because I was going down to Temple, Philly every couple weeks as opposed to every week, but I did see my oncology doctor every week. So when I went to see her, I told her I wasn't feeling good. She weighed me, and I gained quite a bit of weight from my last appointment. It was borderline close to 20, pushing 20 pounds in a week. So she said, there's something definitely wrong. I want you to go see Dr. Mangan, which is Fox Chase Cancer. And that was on a Tuesday. I saw her. I was going to see him that Wednesday, and she said, pack a bag because I really don't think you're going to be coming back. I think you're going to be staying. My mom and I went down, and sure enough, I was admitted because my kidneys were leaking protein, and that was what was causing me to gain so much weight. And it's called nephrotic syndrome. And I don't even know where they come up with these words, but I really didn't research that either because, I'm not really good on the researching thing. And basically, my body was attacking the kidneys because to them it was foreign. And for some people, that's what happens. It attacks an organ, like a major basic organ. And I was one of 2 people that has ever happened to while Dr. Mangan was going through the transplants and stuff. So, of course I have to go big, right? But we did get admitted, and they put in like a port. It was just one little line that they put in through your arm here because I had to get in medicine like right away. I had, over the course of 3 days, 1,000 milligrams of prednisone every day, which was 3,000 milligrams like right off the bat for 3 days. it did help me, and it corrected it, and it stopped my body from attacking itself in the long run. It's part of the reason why I have the issues that I have today, because prednisone is such a strong drug, and the things that it does to your body is not the best, which if you're on it for a long time, I'm sure your doctors have explained to you that the long term that you're on it, the more chances you have of the prednisone may be causing some damage to your body. Like, I'm not a doctor, I'm not a professional, I don't want anybody to think like, oh my god, I take prednisone and stuff like this gonna happen to me. No, it's just what happens to some people, and prednisone has its side effects that they do affect people. So I'm not giving anybody any kind of tips or anything. This is just what happened to me. So I was there and I did the 3,000 milligrams, and they slowly, tapered it off while I was there, and it was done intravenously. Well, while I was there, at the same time, my dad ended up going into the hospital. So my mom was between me and my dad, and we were 2 hours apart. And she did this for almost 2 weeks before I came home, and it was harder on her, I think, than me being sick and my dad being sick, from the fact that she would be with me, hurry up and go home, be with my dad, hurry up and come back. And it was rough, like more on her than anybody, because I basically was just in the room doing the medicine, all of that stuff and everything. And I was back on the transplant floor, so again, it was locked down, all of that stuff, and there were other people there who were having their transplants, and I was basically just there hoping for them to, get my kidneys to correct itself, stop leaking, and fortunately they did. Prednisone was coming down every day, and I was slowly but surely, like, losing the water weight was coming off. It was to the point where you could just rub my arm, like, gently, and there would be little water pockets, bubbles, blisters, and they would just pop as you did this, and this went on for almost 2 weeks because the water had nowhere to go. But eventually it calmed down, it stopped, it was cured, and I was so happy with that. We had my sister's wedding. I was still out of work at the time. I was still limited on the things that I did, where I went, different things like that. So I did kind of try to keep myself out of situations that I didn't have to be in. And I was, I was doing well. I started to experience some stuff little by little towards the end of 2007. As far as my eyes were starting to get dry, my mouth was starting to get dry. It was all these little things. It wasn't something that happened overnight. The day finally came that I was able to go back to work, so I went back to work in 2018. And I was so happy to just be back with everyone and continue to be able to do my job. And things were gradually continuing going really well. And then it basically was kind of like, and it went downhill. And basically what started happening was the grafting started to take hold, and this is, unfortunately what happens to some people, and mine became extremely severe, where my eyes, like, as you can see, are just, they look sickly, honestly, which I already know this because they're so dry. I have to use eye drops 24/7 on a daily basis. At nighttime, I have to use an eye gel. You can see, like, I have pigment issues, which were a lot more noticeable back then. It was, like, all over my face. It was really bad on my neck. I can remember going to see a doctor down in Temple, and he was like an ENT doctor. He's someone who checks your muscles, your nerves and stuff. And one of his comments to me when he first met me, I never met this doctor before, was about my neck. It was really bad. I mean, you can see it, but it was a lot worse. And he literally said to me, oh, you can go see a plastic surgeon that can fix that. And I'm like, okay, douche, like, I'm not doing that. I'm lucky to be alive. I'm not worried about this right now. And I didn't say anything to him at the time. I was just taken aback by the fact, like, this guy literally said this to me, like, I just had a transplant less than a year ago, and you're more worried about how my neck looks. Like, I'm just happy to be alive. It did kind of play a little bit on my mind because I started to wear a lot of scarves, so people couldn't see it, because in my mind, I thought that when someone saw me, that was what they saw, and it wasn't necessarily the case. It was just in my mind. and I kind of let him win in that situation. But as time went on, and from all the medicines I was taking, it did start to help itself. There was like an ointment that they gave me to help try to take away some of it. It never corrected itself, so you can still see I still have all of this. If I wear makeup, I can cover it up and stuff, but most days I don't need to wear makeup because I don't go anywhere. And thankfully, Chris just sees me as who I am, regardless of all of this. And I have like my little tics. You can see, like when I talk, I barely have any lips because they're so dry. Like my mouth is so dry, I don't produce like any saliva anymore. So everything is just like, if I had lips, it would be like duck lips. Like it would be awful. I would never do that. My teeth are extremely bad because my mouth is so dry. They chip, they break very easily. My gums have some issues, so I need at least $4,000 worth of dental work to fix all of these things. So that's why I don't really show my teeth a lot. And like that's something I do plan on working on. I'm at the point right now where I'm like, do I want to get this all fixed, or do I want to just get dentures and not worry about it? Because a lot of my teeth have come out since my transplant because of my transplant. And one of the problems is I have limited mobility in my mouth, in my jaw. So it doesn't really open that far. It's like that far. That's as far as I can open my mouth. So to get dental work done, it's a big pain. This is why my anxiety goes like crazy with the dentist, and my hands will sweat if I even know I have to go for a cleaning, because of like the limited mobilityness. And it took like several years for me to be able to get teeth extracted, because there were doctors who just didn't even feel comfortable with doing it. I have doctors tell me to my face, with my mom sitting there, that because of your condition, I don't feel comfortable with doing that. And you're talking like big name hospitals of doctors who didn't, nope, not touching it. I don't want to have anything to do with that. And literally nobody would help me until I actually came to Maryland in 2018. And Chris's dentist helped me, and he set me up with a dentist that took care of me. And I will show you the video. I'll share that video of how it was after I got my teeth extracted. I'm like one of those people that when you come out of anesthesia was a little crazy. So I'll have to show you guys that video. You'll get a laugh. But this is just some of the things that the grafting does. Like, this is how much your body is changing, and it attacks itself, and it just does all of these things. And sometimes with the medicine, it can help it. It'll take it away. I did medications. I took medications. I went back to Philly, and I was taking this injection drug that they thought were going to help people. And every week I was down there doing this injection for months, at the same time doing physical therapy, and it did absolutely nothing for me. So I literally just said, I'm done. I can't do this anymore. I was getting tired of being picked and prodded, and just your body becomes so tired, and it's already hurting from all of the other stuff that's happening. And to continuously go and take a drug that's just not helping, and you're constantly getting blood work, and you're constantly doing this. Like, I literally was exhausted, and I was working at the same time, and I was happy to be back to work. Everyone was good to me. My job, thank God, like, they were so good to me on the times that I had to take off, or when I was sick and I couldn't make it in. I was on prednisone still, trying to, taper away a lot of the GVH that was happening, because my eyes started to get worse. My mouth started to get worse. It got to the point where I was having a hard time eating. Things were starting to get hung up. I would like choke a little bit. I didn't know what was happening. So we went to go see a gastro doctor down at Temple. They did a scan of my throat, and they saw that the esophagus has very limited opening, and there's scarring, and that's basically from the transplant, from the chemo, from the prednisone. And the first time this had happened, my opening was like really, really small, really, really tight. And when I say that I'm going to get my throat stretched, what they do is they put a tube down there to see how wide the opening is, and it's almost like a balloon type thing that they put in, and it opens to kind of open it so you have more of an opening to be able to eat stuff and digest stuff and everything. It was really bad for a while there. Like, it hurt. I couldn't eat. I was just drinking Boost shakes, having yogurt that like I couldn't drink. I just basically was on like a liquid diet because I couldn't swallow anything until I had it stretched. I have it stretched almost every 6 to 8, 12 months, depending. In 2019, 2020, I had it done 3 times. So it just depends on how bad the opening is or if there's stuff that causes it, but it's never going to be better. So I'm always going to have that done. I can't eat steak. It's not a thing that I don't want to eat the steak. I literally just can't eat it. I can't break it down. I don't produce enough saliva to be able to break down any kind of steak. So like steak, meat is completely out for me. I basically eat chicken, turkey, a cheeseburger here and there depending upon how it's made. But there are like a lot of things that I just can't eat because I just can't break it down to swallow it. I drink a lot of water because that's what I need in order to get things to go down. So when I got sick a couple of weeks ago, it was like a major, like it was a sinus cold that I had, and when that had happened, my throat, started to get sore, and when that happens, my throat swells up a little bit, and when I started coughing, it closes my throat. And it's happened before that it's closed, but it usually fixes itself within like a second or two. And I make like this god awful sound. It's like, and it sounds bad. It really does. But my doctor told me as long as you're making that sound, you're getting air in. The problem was I was getting the air out, but I was having a really hard time getting it back in. So Chris had called 911. The ambulance came. They were extremely fast. They were literally right around the corner. Thankfully, the technician that was there, the paramedic, he knew what GVH was, and I was explaining to him about my throat and everything, and that's why I kind of want to do these videos, because a lot of people don't know about it. And this had happened to me a couple of years ago, that it got so tight I made that thing, I couldn't breathe, went to the emergency room, and I did it in the ER, and the nurse was like, oh my god, what is happening, and I try to, like, he tries to let them know what it is, and I try to let them know what it is so that they don't panic and stuff. So I ended up getting an injection, a steroid injection to help open it up to breathe. And when I got to the emergency room, they did all of that, like on the machines, the monitors and stuff, and I did a breathing treatment to help open that up. And I got some antibiotic, and now I'm like a lot better. I have my throat stretch scheduled for next Friday, so I'll be going to that. And it's just something that's just a part of everyday life. I mean, I don't think it's ever going to be cured. I know there are medications now that are out that they didn't have before. So I'm actually going to look into that at some of the local hospitals down here in Maryland and see if I can start taking some of the new GVH medications. Because back in the day, they didn't really have anything to take other than prednisone. As I mentioned before about the prednisone, because I was on such a high amount for such a short amount of time, and then they try to bring it down, my body started to go through withdrawal when we finally wanted to come off of it. And I have mobility issues. My hands will cramp up, my feet would cramp up, my jaw would literally cramp up. Like, I can't lift my arms any higher than this. I don't really have very good gripping mobility. My arms are at like a constant bend. They don't go straight, and my right ankle is completely locked. It doesn't bend whatsoever. And a lot of this is caused because of, some of it's caused because of the prednisone. I don't want to say all of it, because the prednisone, what it did was it started to break down my muscles. And just from being on such a high dose, coming down to a low dose, and my body got so addicted to it. So when we were finally trying to taper off of it, I was going through major withdrawal. I couldn't get out of bed. I couldn't like lift my head off of the pillow. I would miss work days, and it was like awful. It was a rough time just trying to come off the prednisone itself, aside from having all the other muscle issues. There were parts of like months of my life where I couldn't tie my own shoes. I couldn't bend over. If I were to fall on the ground, I needed help getting up, which I fall, like, to this day I still fall. Not a lot, as much as I used to, but in the beginning I used to fall quite a lot. There were times that I had fallen and I would be home alone, and I literally had to call my mom, and she'd have to come over and pick me up off the floor because I couldn't get up myself. There was a time that I fell outside when I was walking Odin, and I couldn't pick myself up. I couldn't get off of the ground, and I had to walk, not really walk, like crab crawl to, there was a down pole in order to be able to get up. And thankfully I had Odin because he helped me like pick me to get up. It took me a long time to get up, and I called my mom and Scotty came, we went to the emergency room. I had a concussion, I had to stay with her. It's been a rough couple of years because I do have a falling issue, like I have a falling problem. I fell and broke my nose, I fell and sprained my knee, like it's just always something. And it's just because the way I walk is off because I can't bend my right leg, so it just kind of looks like funny when I walk. And it's really weird because my right leg is very weak in the muscle area because I don't really have muscles in my calves, so my left leg is a little bit bigger than my right leg, only because like muscular wise. So you can like tell that there's stuff wrong with me just from talking and looking at me and the way I act and the things that I do. And it's from the transplant, you know, like I'm, to this day, I'm grateful that I had it because it did save my life regardless of what's happening now. I did do things to try to help myself, like physical therapy, like I said, the injections, and then it just came to that point that I just didn't want to do it anymore. I was so disgusted and depressed and unhappy because things that I used to be able to do, things that I used to be able to enjoy, I was no longer able to do or eat or just do things. Like I couldn't ride my bike anymore, and that was something that I would constantly be able to do. I couldn't pick up my nephew David when he was born because I couldn't pick up anything. I was just so weak. My muscles were so bad that I just needed help to do everything, grocery shop, comb my hair. I mean, now I can actually comb it, but so when you see me, it's basically going to be like this, straightened or in a hat, because I can't put it in a ponytail or anything like that unless Chris does it for me. So that's always going to be like that. There's just things that are really never going to change. And I do hope that the medicine that they have now, if I do decide to take it when I see the doctor, maybe it will help, and I hope that it does help. In the meantime, I am just going through different things, like I'm getting my throat done. There's a procedure I'm having done with my eyes. That's something that they do now for people that have GVH. I went to see the eye doctor, and she was amazing. Because I will tell you, a lot of doctors have no idea what GVH is, and it's not their fault. I'm really appreciative that some of the doctors that I did see do know what it was, like know what it is. They're able to read my chart and see everything that's going on with me. And this eye doctor knew about it. And there's procedures that you can have done to help with your eyes because your eyes are so dry that your cornea and everything like in the back of your eye gets affected from that, and then it starts to break down. So I'm having these contacts put in that cover the whole eye, and it's supposed to be like a water bath for a week. So I'm having that done at the end of this month. So for a week, they do one eye at a time, so you're not completely blind. So I have a water bath done in one eye, go back, have it taken out, and then have it done in the other eye. So I will take you on a journey when I have that done. I'm a little nervous because I don't really like anything touching my eyes since I have issues with it, but I do want to try this since they really are so dry, because it does affect your vision more so just from being dry and having to apply eye drops. I'm trying to think. There's not really much else medically wise that I'm going to take care of like in the month of May, because it's 2 weeks is basically going to be out for my eyes, and then the week before that it's going to be for my throat, which it's an in and out procedure. He goes in, he does my throat, and I get to come home that day. So it's not too bad. It sounds a lot worse than what it is. I mean, there are chances that they can scratch your throat and it can, you know, have issues and bleed and stuff like that, but thankfully, knock on wood, I've never had an issue, and I've been having my throat done since 2009, and thank God I've never really had an issue with it. But that's basically what GVH is, and I know a lot of people experience it a lot of different ways. For me, I think it was a combination a little bit of some of the medicine, especially the prednisone, because of my kidney situation, and that's why my muscles broke down. It's hard because you have to rely on other people to do so many things. In the beginning, it was rough because you can't carry anything, you can't do anything. You basically just feel like a weakling because you really can't take care of yourself. I mean, even today, there are still things I can't even wear because I can't raise my arms to be able to put it on or anything like that. It has gotten better over the years. It used to be really bad, but it is a little bit better now, so I'm happy for that. Can't really think of anything else, since I think that that might be a lot, and since I kind of keep going on and on. But I did want to be honest and show everyone like what it looks like, as far as how I really do look sickly, and how it makes a difference with, you know, the way my eyes are and kind of like sunken in a little bit and stuff. And it's just things that happen after the fact, and I know some people have it way worse. And I do hope that all those people that do watch this, and if you do have anything going on with you, please reach out. We can talk about it. I can be here for anyone who needs to talk about anything. It doesn't even just have to be cancer, because I know there are so many of you that are going through so many other things. And it's nice to have people that you can reach out to and talk with and just have fun with, and not just focus so much about the illness. So I'm just happy that I have a group of people that I get to do that with. And I will say that some of the biggest things that had gotten me through all of this is music. Because for 100 days you can't basically go outside, so what you have really is movies and music. And I mean, music has helped me, and it still helps me to this day. If I'm having a bad day and I don't feel good, I just throw on some MGK, Machine Gun Kelly, or I listen to Chris Brown, and they, you know, they just make it better for me. I don't know what it is. It's just something with their music. It just, you know, when there's a music or a band or a group or an individual that just hits your soul, you know, you just stick with them. So that's, like, I listen to them, and they make a bad day feel better. And I'm thankful that I have Chris, because he takes care of me and he makes me laugh on the daily. And we're definitely gonna do a combined thing. So if everyone has any questions with him of how it is living with someone like that, just doing different things and other stuff like that, like, let me know. We'd be more than happy to answer it. So give me a like on the video if you like it. If you have any questions, let me know. Tomorrow we're headed out to Ocean City to see his family, so I'm excited about that, because they're having this thing what's called Spring Fest, which I've never been to, and they have a ton of tents and stuff. So I'll do a little video while we're there to show you what that's like. But even if you have an illness and you're going through some things, you know, there's always a light at the end of the, like a pot of gold at the end of the rainbow, or there's always a rainbow after the rain. There's just always something to look forward to, though it might be cloudy now, but it may not be tomorrow. So stay happy, and if you need anything, let me know. I'm always here. DM me, email me, anything like that. But thank you for watching, and I will talk to y'all soon. Bye.